Right now to a Team 10 investigation. For the first time, we are hearing concerns from several former employees about San Diego's new ambulance provider, Falck. They say the company is falling short in its overall service to the city.
They spoke only with our Team 10 investigator, Melissa Masiha, about the challenges they say that company is facing.
At least 3 former Falck EMTs told me the company was not prepared when it took over in November, from issues with payroll to staffing. Falck leadership said the pandemic played a huge role in these problems. The former employees not convinced.
It's the best job in the world.
EMT Sean Kellhofer worked for ambulance provider AMR. He moved over to Falck when it took over the city's contract.
It was deciding to continue with the city. I really enjoyed working in the city.
He was excited in the beginning.
It was really cool. We had these things called auto loaders. You just click a button on the gurney and it raises it. Some hydraulic arms raises the gurney, saves your back quite a bit.
But Kellhofer said the honeymoon ended quickly, for the first time publicly talking about the problems.
The low morale and the getting ran into the ground from calls. We had multiple units throughout the city shut down almost every single day.
He left Falck after less than 2 months in early January and went back to AMR. Another EMT who switched from AMR to Falck agreed the company was not prepared. Jeremiah Coburn said in his ambulance the first day,
we did not have an adequate amount of supplies to go on our rig.
That was day 1.
Yeah, that was like literally hour 1.
He also dealt with payroll problems.
They owed me 96 hours of PTO. They weren't paying me my appropriate double time. Even the simplest things were getting screwed up. You can't not pay your people.
Coburn returned to AMR as well. Another former Falck EMT who didn't want to be identified for privacy concerns also confirmed his full pay was delayed twice.
We're aware that there have been some issues with payroll.
That's Jeff Boehm, managing director for Falck San Diego. He said payroll issues were in part due to a program problem and ransomware attack.
Everyone's going to get paid every dollar that they earn. No one's going to walk away without having their full paycheck.
A lot of our conversation, though, devoted to staffing and what the company said it was going to bring to the city. Public records show Falck has consistently fallen below what was promised. Under the new agreement, the company was supposed to have 1,008 unit hours a day. That's the daily number of hours ambulances are scheduled. Data from the city of San Diego shows from November 27th to February 20th, Falck reached 1,008 hours only 7 times. In January, Falck was below 900 hours 20 of the 31 days. That's about the same amount of hours AMR said it could do to keep the city's contract. Boehm said a big reason for the low hours was the Omicron variant, the workforce out sick with COVID or because of COVID protocols. He also said first responders left the industry.
We came into this a little short in staffing, and then it's challenging to bring more people in.
Team 10 also received city data for what's referred to as level 0 days. That means there are no ambulances available. Records show this happened more than 1,700 instances in January. Periods of no ambulances in the city could last a few seconds or at times more than 20 minutes. When attending public city meetings last year, Falck leadership was confident it would meet its goals and provide better service than AMR. In April 2021, this was Falck Chief Commercial Officer Troy Hagan.
You are committing to the service hours that you put forth within your response to the RFP. Is that correct?
Yes, that is absolutely correct. We've gone through this entire process. We've built this plan together to commit those resources. So unequivocally, yes.
A couple months prior, then Falck CEO Matt Gallagher said this.
One of our critical path items is to make sure that we have the staffing level day one to meet the unit hours that we promised.
At this point, is that promise broken?
So in terms of last year, just so you know, I started with Falck on October 4th of 2021. So I wasn't here for some of the discussions that went on previous to my tenure, but certainly it's been our goal to get where we need to be with our staffing.
We also spoke to San Diego Fire EMS Deputy Chief Jody Pierce about Falck.
Are you satisfied with what they are providing right now?
I remain optimistic about the contract and the future.
This San Diego Fire Rescue Bulletin from February 2nd admits difficulty with the emergency medical services transportation system. It refers to challenges and instances where company officers have decided to transport a patient on a fire apparatus.
The bulletin was provided to provide guidance to the workforce, but was not utilized during the surge.
So as far as you're aware, there haven't been any patients that have been transported on any fire trucks or engines.
Correct.
Pierce said final data for Falck's response times aren't in yet. Falck said they're either close to or have met the requirements for priority calls.
The city will continue to work with Falck, and we will continue to uphold the contract and hold Falck accountable.
Do you feel that Falck overpromised?
I do. I think they promised just a little bit too much for what they can handle.
I looked at level 0 numbers for the first 3 weeks in February. So far, there has been an improvement. The city's Public Safety and Livable Neighborhoods Committee is scheduled to talk about Falck during its meeting on Wednesday. Melissa Masiha, Team 10.